Welcome to the WRAL Daily Download. I'm Grace Holland. Questions continue about what is going on inside Holly Hill Hospital in Raleigh. Psychiatric and addiction care facility has been under the microscope ever since several patients, kids and teens, escaped from the hospital this year. This week, a new report found that Holly Hill didn't do enough to prevent those escapes. WRAL's Heidi Kirk has been following this story since the spring. Heidi, thanks for being here.
Absolutely. Thanks for having me, Grace.
So, kind of explain to our listeners what goes on at Holly Hill in terms of the kind of care that they provide.
Absolutely. And I like to clarify this because there actually are two campuses. One of them is for children and one of them is for adults. So if you drive up to Holly Hill, there are two addresses, and one of them is specifically for people all the way up to 18, and then the other one is for anyone else beyond that. They offer both inpatient and outpatient care at the facilities. It's in East Raleigh, and if you drive up to it, you'll notice it's kind of in a wooded area. So as we've been doing our reporting, you'll notice that when we talk about the escapes, it's very obvious where those children went. I mean, directly into the woods surrounding these facilities.
Right. And these escapes and issues have really mainly been focused on that kids and teens campus, right?
Exactly. In fact, just recently, we've only really started to hear a little more about the adult facility. I mean, most of the issues that we've talked about and heard about so far are directly out of the children's facility.
Right. And so this report that you were able to get this week, can you walk us through, first of all, how you got that? Obviously, that can be kind of confusing for people because we do a lot of getting documents here in the news business. And what did it say?
Absolutely. Well, I love the question right off the bat because I do think that most people don't know what it takes to get documents. I think that we as journalists do it so often, but regular people might now have no idea.
Right.
And so what we do is we go to the Department of Health and Human Services, what I did, and they normally have a media tab, and you might just overlook that unless you're a journalist, but you click on that tab, and there's often a place where you can request those documents. So essentially, I was looking specifically for inspection reports for the last 3 years, and it took a few weeks. We'd like to think that we get a quick turnaround, but when we broke the news on Monday, we had just gotten those reports into my inbox. We combed through documents and were really looking to see what they said. And it's not easy to understand. We'd like to think as journalists we have the biggest brains ever, but it's clunky language. It's jargony. And so we combed through them, and I'm going to look at my notes because I want to really narrow down at the things that we found. I highlighted the biggest three. I mean, there's a lot of violations here, but we were looking for, what are the biggest issues within this facility? And one of them shows that inspectors found Holly Hill failed to provide an aftercare appointment for at least one of 15 discharged patients. And you might hear 1 out of 15, maybe not so many, but that's just a small subsection that they were looking at. And even if one patient isn't getting aftercare, their parents or guardians or whoever they're living with, if they don't know how to care for them, it's a really big deal. Another one that really stood out to me is it showed the facility failed to ensure a master treatment plan was completed and updated for 4 of 11 medical records reviewed. I mean, that's a pretty high percentage. They weren't updating their charts. And that's something that we've heard from former, current employees, also patients, that they're not getting the latest up-to-date information about their children or about themselves, really. And the third one here is that it showed the facility didn't provide medication prescription at discharge on more than one occasion, which really is huge. I mean, people go in there for help, and medication can really be the thing that saves a life or makes a big difference. And so in those instances when they weren't receiving medication, I can only imagine, how those patients felt.
Right. Yeah. And I think about, if someone had a heart condition and they didn't get their heart medication, that would be considered a really big problem. And when you're talking about behavioral issues, it can be just as important, like you said.
Exactly.
So what has been the reaction from some of the families whose loved ones have been treated there in hearing the details of this report?
Absolutely. Well, we've connected with over 70 families. I actually just did the research to try to track down a number, more than 70. And those are just messages that I've received into my inbox or someone has sent me directly. And so, of course, whenever we got these documents, I was immediately wanting to talk to those people. I mean, it really impacts them. And I think the one word that comes to mind is validation. I mean, these parents and patients themselves, guardians, whoever it is, brought these issues to our attention a long time ago. But to have that documentation to back it up really proves that, inspectors from the agency that oversees Holly Hill, DHHS, has found there's problems too. And so not only were they validated, they're also frustrated. It's so sad to see, a facility like this that handles so many patients, especially at a very young age, really letting things slip through the cracks. And on multiple occasions, we found that in records from years ago, they have some of the same violations that they have all the way up to 2024. So it's really frustrating, especially for parents who may have sent their kids to that facility to receive the help they need. Of course, some people go in there under involuntary commitment, but for the parents that sent their kids there especially, it's just infuriating and angering and frustrating. I mean, there's not enough words to really describe it,
Right.
to know that they're not getting the care they needed.
And you mentioned earlier that you have also been talking to employees. What have they been seeing? What insight have they shared with you about how things are working inside Holly Hill on a day-to-day basis?
Absolutely. One of the things I'll mention is that we've talked to a number of current employees. Those tend to be the ones that are the most nervous to talk to us. Of course, they don't want to lose their jobs. They want to be careful about the things that they're saying. So we're protecting every single employee that we've talked to, their identities, as well as former employees. A lot of the current employees are not surprised to hear these reports coming out. They have for a while been speaking up about the issues within the facility. A big one is understaffing. We reached out to the facility and said, are you fully staffed? And they told us yes. And we brought those two current employees and they tell us, no, they're not. They are not fully staffed. We're struggling. Another really impactful conversation that I had, which was with former high-ranking employees. We sat down with two of them anonymously. They were bigwigs back at Holly Hill. They don't work there anymore. But one thing that they said is that the staff just doesn't get the proper training. And it really is a trickle-down effect. If your staff members aren't trained, if your leadership isn't trained in how to run a facility like this, there's going to be issues. And so they brought all of that to our attention. And it's interesting because they highlighted a number of issues, but they all told us it comes back to having untrained and not enough staff, and so things fall through the cracks. They don't know how to handle some of the issues within the facility, and it's really sad to hear those stories.
Yeah. Let's take a quick break right there, and we'll be right back. Heidi, before the break, we were talking about what the reaction has been to this report from people who have had patients there or have been patients themselves or have worked at Holly Hill. What is Holly Hill officials, what's their on the record response to all of this?
Mm-hmm. Well, it's really been a mixed bag. We've reached out to them a number of times. Pretty much any time we do a report as journalists, it's the right thing to do to reach out to them. So we brought them concerns from current employees, from former employees, from parents, from patients themselves, and we write them out and we asked for their response. And sometimes we don't get one. Sometimes we hear nothing. We give them a deadline and they don't get back to us. A few times they have, and they'll send us a statement. We receive that statement, and it's been directly from their CEO. And she writes out a little bit of a paragraph addressing the concerns. But I'll be honest with you, she denies most of the things that we brought to her. She says that's simply not happening. I mean, you heard me address it with the staffing shortages. That's one of the big questions we've had because so many former and current employees have brought that up. But she said it's just not true. So it kind of becomes a he said, she said situation. But there's also questions that we've asked that we've just received no response to. So we really don't know the answers to those questions. For instance, a report that we did on Wednesday specifically, we didn't get a response all day. So it's one of those situations where we reach out and, we never really know what we're going to get.
Right. And was there any response to some of the report that came out from NCDHHS? I mean, that's not a he said, she said. That's an official state agency putting that information out there.
Of course, and I'm glad you asked. We highlighted specifically some of the things that come out of that report. And Holly Hill says, yes, we had a few things slip through the cracks, but we're addressing them. And in those reports, it does show where DHHS corrected those things. They came in, they did the inspection, they let Holly Hill know, and there is a corrective action plan there. But, that brings up the question, how does DHHS hold Holly Hill accountable for actually doing that? And we actually reached out to DHHS on Wednesday and asked them that question. They say, we do come back to the facility anytime there's a violation on one of these inspections unannounced, and we make sure that they do it. But it still leaves us with a few questions, and we actually asked DHHS, the facility or the organization rather that oversees Holly Hill, for an interview, and they didn't even acknowledge our request. So there's still a lot of questions hanging out there.
Yeah, definitely. In the midst of all of that, have we heard anything from legislators or oversight groups about the operations there?
Well, that's one of the things that parents ask us specifically. They want to know where they can go from here, where we can get action. So we've reached out to a number of lawmakers. In fact, on Wednesday, we reached out to 15 specifically. It's not something that we expect to get a response to immediately. We haven't heard back from any of them right now, but we're hoping that they can take action. Of course, these are the people that, make our laws, and these are the people that, parents, children, people who've been impacted by this facility, they want to hear from them. So we're hoping to get a response back at some point. We're not expecting it to be immediate, but we'd like to at least make sure that they know what's going on behind closed doors. As for advocacy organizations, we've reached out to quite a few. One of them is NAMI, and they're a mental health organization, a nonprofit based in North Carolina. They have them all across the country. What they say is that they're not surprised. There are a lot of issues in these mental health facilities, and they continue to be an advocate for families. They want to talk to legislators and really make some change here.
All right. Well, thank you so much, Heidi, and thank you for listening to the WRAL Daily Download. Another great way to get WRAL news is the Morning Briefing newsletter. It's a daily email that's waiting in your inbox every morning with local news, events, and headlines to get you ready for the day. Sign up at WRAL.com/newsletter.